Hi, my name is Chris von Rosenbach. I'm a dentist in partnership with the Dental Health Group in Burlington, Ontario. A question we frequently get is I or a member of my family am very nervous. I'm apprehensive. I'm a little scared of going to the dentist. As a matter of fact, the things that scare me the most are getting freezing or having, big items of equipment in my mouth. I just don't like it. What can I do to make myself a little more comfortable in the environment of the dental office? There are some really excellent techniques, many of which we employ in the office here. Being kind, being gentle, talking with our patients, good communication, that's oftentimes the very first thing that takes away apprehension and takes away fears. But if, say, for example, talking is just not enough, what else can be done? Well, hypnosis, drug-free way of getting relaxation. There is also a number of other techniques beyond the non-pharmacologic approaches, which is a fancy way of saying, are there medications that we can take? And the answer is yes, there are. One of the oldest and most continuously in use techniques is called laughing gas or nitrous oxide. You probably have heard of this. It's little nose pieces fitted over the nose. And the colorless, odorless gas is inhaled. It takes a little bit of time to get you to the proper level, but most dentists use this technique, and we use it ourselves almost on a weekly basis, in some cases a daily basis, to help people get over some of their apprehensions and be able to get through the things that the dentist needs to do. Sometimes people don't want to have a mask fitted over their faces or anything else. Well, there are oral medications, pills. You've probably heard of Valium, which is a benzodiazepine medication. Single drug regimens can also help take away the apprehension and fear that you or a family member may feel. So if you have decided to take a medication, there are certain things that are important to know about. One is your general health. The American Society of Anesthesiologists rates health in terms of level 1, level 2, level 3, level 4, and level 5. Generally, when we are using the techniques of nitrous oxide and say, for example, an oral medication, you will want to be ASA status 1 or 2. And that means you're either perfectly healthy and don't have any issues at all, or perhaps you have got something like diabetes or epilepsy, but it's mild and it's well controlled. The key is it has to be well controlled. If you have things like hypertension or high blood pressure and it is not well controlled, then you slide into ASA status 3, and then perhaps it's not appropriate for you to be treated in a dental office environment. You need to know how healthy you are, what medications you're taking, and you also have to, of course, discuss this with your dentist. In the city of Burlington and in Hamilton and Oakville, our sister communities on either side of us, we are very fortunate in that we have specially trained dental professionals who are known as dental anesthesiologists who can use more sophisticated techniques with a combination of oral medications or perhaps using intravenous techniques where you can be given a higher and higher level of sedation. And these are techniques for people who are absolutely so fearful that they cannot come into the dental office at all. They often request that they be put right out. Being put right out is something that doesn't happen very often for dental treatments, but deep sedation is something that is very frequently used in dental office situations. So finishing off, if you have a desire to find out about some of the sedation techniques that are available to us and think that they may be appropriate for you or a member of your family, come talk to us. Come talk to one of our very knowledgeable dentists and find out what level of sedation or anxiety relief is appropriate for you.